Hi, and welcome to CJC Online Church. This is indeed a privilege for us to share with you as we glorify God, as we honor Him, as we praise His name. Welcome to Your Health and You. Of course, every time that we come on, we give the same instruction because it's very important as we share the gospel message, as we share the health message with the world that you like. Definitely like. Of course, we want you to like. We want you to share. We want you to subscribe because all this helps us spread the gospel of Jesus. And the truth is, it costs you nothing to press that like button. It costs you nothing to share this on your status. And it costs you nothing to subscribe and click that notification bell. We have a program lined up for you that will discuss a topic that many persons may have come across and wondering exactly what to do and how to treat it. So, Your Health and You is a production of the Central General Conference of Seventh day Adventist Health Ministries Department, designed to present on health related topics by sharing evidence based information and naturopathic remedies. Your Health and You is aired every Thursday at, of course, the usual time was 7:15, but for the next few weeks, we'll be at 6 o'clock as we focus on general health on first Thursdays, men's health on second Thursdays, women's health on third Thursdays, children's health on fourth Thursdays, and mental health on fifth Thursdays. Of course, this is a fourth Thursday, and hence we're looking at children's health. However, the topic that we have today, yes, is diagnosing children, but of course, continue into adulthood, and there are some adults who are diagnosed very late with this condition. So, a quick disclaimer before we get into our program today. This program is for educational and informational purposes only and does not constitute providing medical advice or professional services. Before embarking on any health related information presented in this series, kindly seek advice or counsel from a medical doctor or a healthcare professional. We want to make sure that you're safe. Now, in today's program, we will be speaking about autism. But before we dive into our topic for today, we're going to have a reading from the book Counsels on Health by Ellen G. White.
The violation of physical law.
As in the days of Noah, Christ has left us here a most important lesson. He would lay before us the danger of making our eating and drinking paramount. He presents the result of unrestrained indulgence of appetite. The moral powers are enfeebled so that sin does not appear sinful. Crime is lightly regarded, and passion controls the mind until good principles and impulses are rooted out and God is blasphemed. All this is the result of eating and drinking to excess. This is the very condition of things which Christ declares will exist at His second coming. The Savior presents to us something higher to toil for than merely what we shall eat and drink and wherewithal we shall be clothed. Eating, drinking, and dressing are carried to such excess that they become crimes. They are among the marked sins of the last days and constitute a sign of Christ's soon coming. Time, money, strength, which all belong to the Lord, but which He has entrusted to us, are wasted in superfluities of dress and luxuries for the perverted appetite, which lessen vitality and bring suffering and decay. It is impossible to present our bodies a living sacrifice to God when we continually fill them with corruption and disease by our own sinful indulgence. Knowledge must be gained in regard to how to eat and drink and dress so as to preserve health. Sickness is the result of violating nature's law. Our first duty, one which we owe to God, to ourselves, and to our fellow men, is to obey the laws of God. These include the laws of health.
Let us pray. Our Heavenly Father, we are grateful to you for the health message that you've given your church. We ask that as we contemplate, as we discuss, as we look at the scientific evidence that backs up what we believe and how we ought to treat our bodies, that you will be with us. May your Holy Spirit lead us, guide us, and direct us. May once again that as you caution us from your word, as you give us guidance from the councils, that you will help us to do your will, and that we truly represent you. We thank you, we praise you, and we ask for your blessing upon this evening's program, we pray. In Jesus' name, amen and amen.
Celebrations. Environment. Life only flourishes in suitable environments with the appropriate balance of climate, water, soil, and air. Your environment is crucial for your health, so it's important to take care of it. Research shows the seriousness of environmental pollution. Industrial waste directly affects the two elements most needed for survival: water and air. Though the impact may not be observed instantaneously, such pollution can cause long-term destruction. Deforestation is another worldwide environmental issue. On a massive scale, deforestation often results in damage to the quality of the land. Although about 30% of the Earth's surface is still covered by forest, large tracts of land are still lost to deforestation every year. As stewards of the Earth, it is our responsibility to manage the environment and its resources. Health is God's gift to us, and we must do all we can to maintain the best environment for a healthy life.
The Seventh-day Adventist Church Central Jamaica Conference, in collaboration with the Christiana and Spalding's District of Churches, presents the Good News Gospel Campaign and Community Empowerment Program. Join us from April 20 to May 18 under the Big Tent at Cobbler Playfield. Come experience power-packed preaching, soul-stirring music, prayer and fasting, marriages, baptisms, baby dedications, free Heart NSDA Trust certification, free health care, RGD services, prizes and surprises. That's the Good News Gospel Campaign and Community Empowerment Program, April 20 to May 18 at the Cobbler Playfield. See you there.
Hi, and welcome back. Thanks for joining us here on Your Health and You, CJC Online Church. And of course, I'd like to welcome those who are watching, Aquila, Cecile, Paulette, Everett, Maxine, Dr. Clark. Thank you very much for being here and being on and being a part of our program today. Now, of course, we're looking at the topic autism. So, did you know? The word autism is derived from the Greek word autos, meaning self. Literally meaning of autism is alone, and you can understand why that would have come about. A part of the spectrum of autism, we have Alzheimer's disease. It's the name after a German scientist that is on the high functioning part of autism. And some persons with autism or autistic don't really like being labeled with the German doctor because of the experiment he did on children. So that's something you need to know. All right, so autism is found to be more prevalent than childhood cancer, diabetes, and AIDS combined. So yes, autism is quite prevalent. Research has shown that dogs are linked to improve the quality of life of autistic children, helping with their aggressive behavior and promoting independence and safety. So the so-called man's best friend is actually a good friend to an autistic individual. Now, boys are nearly 4 times more likely than girls to be diagnosed with autism spectrum disorder. And that's because maybe how the tests were first created, they were created mainly for boys. And of course, Caucasian boys. So you may see some little description when it comes on to even persons of minorities. All right. Of course, children born to older parents are at a higher risk of having autism. Parents who have a child with autism have a 2 to 8% chance of having a second child who is also affected. And studies have shown that among identical twins, if one child is autistic, the other will be affected about 36 to 95% of the time. So we're looking at this topic of autism. Now, our guest speaker, our guest presenter is Dr. Curtis Price. And indeed, he is the president of the Pediatric Association of Jamaica. He is a pediatric consultant at the Mapen Hospital and the manager of the Gilead Pediatric Center. That's where it's coming from right now. All right. In Mapen and Clarendon. He has dual passion for primary and secondary care, pediatric care, and having completed an undergraduate and postgraduate studies at the University of West Indies, Jamaica, in pediatrics, having presented at various conferences locally, internationally, on various pediatric and lifestyle topics. He enjoys serving as an associate lecturer for the University of the West Indies, the Caribbean School of Medical Sciences, the Windsor School, and All American Institute for Medical Sciences. Dr. Price is well experienced, and we're very, very happy to have him as he will share his wealth of knowledge with us. Before Dr. Price comes on, we will have a short break. And I want you to know before that break, make sure you place your questions in the chat so that, of course, we can ask them for you. And of course, it's a live program, so your interaction is very, very important to us. And Davina also, welcome, Davina. So make sure that we have a little dialogue going on as we go into a discussion on autism. So before we go to Dr. Price, we're going to have a short little break, and then right afterward, we're going to come and have a discussion on autism.
The amount of time a child spends sleeping may influence their behavior. A study with 5 to 6-year-old kids found that those who slept less than 9 hours a day were more likely to develop attention problems, behavioral issues, and other psychiatric symptoms. In fact, those who slept less were 3 to 5 times more likely to experience those issues. That's a fact, but there's hope. Kids need lots of sleep, but figuring out how much isn't rocket science. Although needs vary, on average, infants require 13 to 18 hours per day. 1 to 3-year-olds, 12 to 14 hours. 3 to 5-year-olds, 11 to 13 hours. 5 to 12-year-olds, 10 to 11 hours. And 12 to 18-year-olds, 8.5 to 9.5 hours. Figure out what time your child needs to go to bed by counting back from the time they wake up. Then adjust their bedtime and see them growing healthier and happier.
Welcome back and welcome Dr. Curtis Price, our pediatrician, our consultant, to help guide us through this topic of autism.
Thank you for having me.
So, Dr. Price, what exactly is autism and why is it considered a spectrum disorder?
Okay, so thanks again for having me. Douglas, thanks for inviting me. It's always my pleasure. Autism has been defined as a neurodevelopmental disorder. So it affects the brain development, and it also affects the natural development of children in various domains, in multiple domains. So it's referred to as a neurodevelopmental disorder. And it basically affects areas of communication, how the child interacts, how the child behaves, and how the child learns. It's regarded as a spectrum. So previously they used to talk about, the Asperger's and various subdivisions. But the new guidelines that define autism in terms of a spectrum, and children can be placed on various ends of the spectrum or in between. So you have children who have milder symptoms, and they will be placed at a level 1, and you have children with more severe symptoms, which will be placed at a higher level. So that's basically what autism is.
All right. So one of the issues that people have with autism or being an autistic child is that they're saying that, hey, it's more prevalent now in our time than it was in the past. I'm not sure how true that is, whether or not it is more prevalent or that we have become better able at diagnosing autism. So I want you to speak to that, and I also want you to speak to what causes autism in the first place. What are the risk factors that lead to it?
All right. So if you look at the research and the various researchers, they'll tell you that it's not necessarily an increase in incidence of autism, but people are more aware. Doctors are more skilled, are more attuned to looking for, and they have various these tools that can be used to to pick up children and that sort of thing. Some individuals are also saying there's an increase in prevalence. Personally, and I'm not speaking on behalf of the Pediatric Association of Jamaica, we are seeing, voluminous increase in numbers of autistic children. And I personally believe that there is indeed an increase in incidents, in numbers. I know in my office personally, I have seen the numbers of cases of autism increasing over the past couple of years. I mean, post-COVID, the numbers appear to have rapidly increased as well. So it might be a combination of, just the parents being aware, taking the children at an earlier time, because they would have heard stuff on the television. People are talking about it on YouTube, and that sort of thing. What was the second question? Sorry.
What causes autism?
All right. So the cause, I would start out by saying that the cause of autism is unknown, and I think a Nobel Prize will be given to somebody who, really come up with what really caused autism. And that's probably related to the fact that there's a multiplicity of causes. There's obviously a genetic predisposition, because as you mentioned in your preamble, we know that there's twin evidence of one twin having the condition. Another, I have a mother with 3 children, 3 boys, and all of them are autistic. All right, and we have situations where you have the parents are autistic and their children are. So there are definitely some genetic situation. We know that children with Down syndrome, a condition called Fragile X syndrome, tuberous sclerosis, which we can regard them as genetic diseases, chromosomal diseases. Those children are at higher risk of developing autism. Maternal age, you hinted at earlier, especially paternal age, right?
Really?
Paternal age, right? So the father more so than the mother. There is a definitely increased risk of autism. Premature babies are also at higher risk of autism. If a mother was on certain medications during pregnancy, such as valproic acid, which is a medication that we use to treat seizures, they're at higher risk of developing autism as well.
No, it's interesting.
Go ahead.
No, it's interesting that you mentioned that when it comes to Down syndrome, it is normally the maternal age is a problem. But you're saying for autism, it is the paternal age that may be a problem. That's interesting.
Yeah, and it's both maternal and paternal, but there's a higher, tendency for for paternal age to correlate with you having a child with autism.
Mhm. So, what are the risk factors? I once heard that if you have pregnancies too close to each other within a year, that can also be a risk factor. How much truth exists in that?
All right. The thing is that the whole issue of autism is really evolving, and a lot of people are doing their research and stuff. I'm not seeing any research proving that particular point. the risk factors are many, and if you do your Google search, there's a long list of stuff that people will come up with. Some of the things that I mentioned before, some of the things are a little more controversial. Some of the things are not proven to be so. I mean, people still hang on to them because it's easy to kind of associate certain
Mhm.
things. For example, vaccination.
Right.
A lot of individuals would say that vaccine, especially the measles, mumps, and rubella vaccine, that's what causes autism. But the fact of the matter is that the measles, mumps, and rubella vaccine is given at the same time that autism symptoms usually present. Usually about 18 months to 2 years. That's the time when you get your children with autism presenting, and that's the time when the vaccine is given. Um, so there are a number of individuals who posit various causes. A lot of them are not necessarily so. There's a strong environmental risk as well. I read an article where they did some research on the mothers, and they found that in the cord blood, that is the blood that supplies the baby from the mother with nutrients, and remove nutrients on the body. When they checked the cord blood, there were 200 toxins found in a lot of mothers' cord blood, right? So there might be, well, definitely some environmental factors interacting with with the genetic factors, because obviously there are some children who are exposed to the same thing and they don't develop autism. So it's a
Mhm.
complex interaction, and the exact cause, is not really known.
All right. I'm glad that you mentioned that vaccination is not a cause of autism. And for those who still believe that, they need to just go back and look at the research, because it was one doctor who came up with the research, and that research has been proven to be false and debunked because it could not be replicated. And his sample size was extremely small and his assumptions were off. So vaccines don't lead to autism. Some will say that it's the metals in the vaccine, like aluminum, that may cause it, but that's also not proven. So we're glad that we have debunked that, because Dr. Price, we did a program already on immunization. For those who didn't watch that program, um, how important is the vaccination regime, especially the MMR vaccine?
Mhm. Um, we had, as you said, we had mentioned the importance of vaccination in the last program. The measles, mumps, and rubella vaccine is a pretty safe vaccine with very minimal side effects. We're having an outbreak, or we have been having outbreaks of measles in the US and in various parts of the world, because of individuals hearing about these research that suggest MMR, the measles vaccine, causing autism, and they pull their children from getting the vaccine. What we're seeing now is a number of children. We have children who die from what we call encephalitis, their brain become invaded by the viruses, the measles virus. Many people, especially the males, well, definitely the males, they become sterile because
Hmm.
the mumps vaccine affects the testes and their reproductive capacity, and that sort of thing. Lots of children end up with brain damage because they weren't immunized, right? So it's a pretty safe vaccine, and there's definitely no suggestion. They have done multiple research, unbiased research, which shows no indication of association between autism and the vaccine.
Clear, 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 clear. And I hope everyone understands this, because that vaccine is very important for development. It's important that person will die from measles, from sterility because of it. So it's important that you get your vaccination for your children on time and on schedule. And of course, it's free here in Jamaica. And I think because we have just like eradicated measles, mumps, and rubella from Jamaica, people don't understand how severe those diseases were in the past. All right, so we don't need to get back to the past. We need to stay where we are right now with our children being healthy. right. So my next question then is, what are the symptoms of autism? How do we know that a child is autistic?
All right. So as I said before, there are problems with communication, just the way they interact, the way they behave, and the way they learn. A child with autism, a lot of them present to the office because they are not talking, right? And that is a very common presentation. That tends to be the one that cause the parents to come out to get them checked up quickly, So they'll come and say, "Boy, my child, I don't know if he's hearing, but he's just not talking, and he's 2 years old, and all he's saying is dada." Right? And then when
Mm,
we delve into the situation, we find that he's doing, multiple other things. Right? So there are problems with communication. The communication might be both expressive. So no two children with autism are alike. So you might have a child with, these problems with expression. So he doesn't speak at all. I have a little child that came into my office, and the mother cannot stop the child from talking, right? But then her communication is not, a socially, interactive sort of communication. So she talks, but the mother would say that she doesn't communicate with her. She's not
mhm.
linking with her. She just say a lot of words, but but that is it. Of course, they have the other end of the spectrum where the children communicate quite fluently, right? But sometimes they don't understand the nuances of the communication. So a child might not understand, you make a joke, Jamaicans say you crack a joke, and they
Mhm.
absolutely don't get it. They
Right.
take the things literally.
Mm,
There was somebody who made, I don't remember what the joke was about a chair, and it was, they were in a group, and the guy at university went and took up the chair.
right.
I wish I remember, the context of that stuff. So they take things literally, they don't quite understand. A lot of the older ones, they have problems with just communicating, making friends, because they don't understand the whole nuances of, the whole communication process. So small children, younger ones, are going to present a little differently, from the older ones. Some of the behaviors, they have repetitive behaviors. So they flap their hands when they're
Mhm.
excited. You see them flapping their hands. They tippy toe. They spin for hours.
Mm,
Banging the head, can occur, but that flapping of the hands and the tipping of the toe, sort of interaction, they do a lot of that. They're very sensitive to sensory stimuli. So, and that's one of the reasons why they don't do well in the public, and you have the flashing lights, and that sort of thing. So taking the child, the parents with autism, taking the children out to the supermarket,
mm.
to, you're having Christmas lighting ceremony. That's a worse place for an autistic child because they
Wow.
have problems with the sensory, input. So you will see them covering their ears. The stimulus might not even be very noxious. Might not be a very loud,
Mhm.
jarring sound. But you see that child just constantly covering his ears. They might refuse to be hugged or to be touched. And then on the other end of the spectrum, I had a child who came into the office, and she walked in, ran right up to me, climbed up on the chair, hugged my head, my neck, and she was just all over me, right? So they're not, the same. You might have one child at one end of the spectrum with respect to communication and socialization, another child at the other end, and within that same child, it might vary from time to time. Um, Lack of eye contact is a
Mhm.
very subtle cue that we look for. So the mother might say, "Boy, I don't feel bonded to this child because she just don't look at me. She don't, And they might have a little interaction where they look at it to the side of their eyes instead of looking at you directly. Um, their failure to respond to their names. That is one of the very early signs. And even
Mm,
earlier than that, a parent might tell you that my child never smiled with me. So you know that social smile occur at about 2 years.
right.
The child mother said, as far as I recall, this child has never smiled with me. I don't feel bonded to the child,
Mm.
that sort of thing. Some of them will lack play and interacting with their peers. So the teacher will tell you that this child sits in the corner, he doesn't play with the other child at all. Or, as I said, there's always a spectrum. Or if they play, their play is a little unusual, some of them. So they'll step into the group and, they don't know the people and they just barge in and, just start talking, or start pushing or start hugging these strangers in that particular
Mm.
context, and that sort of thing. Pointing, so the child might not go through the whole process of developmental pointing. So they may point, but the point is not related to I'm pointing at something to get your attention so we can enjoy it together. It's a different type of pointing. So I might point to things that they want you to go for. So they're not talking, they point, I want juice, they point on the juice, expect you to, to go and get the juice. But that point where a child points on something to say, hey, look at that bird, even though they're not
Right.
talking, and looking at you to and fro to, to kind of enjoy a particular scenery with them. The autistic children don't do that. When they talk about learning, some of them, I have a 1-year-old who counts from 1 to probably 1,000 forward and backward, and the child
Wow.
is 2
One.
years, right?
Mm.
So some of them have these, very unusual. I know of an autistic child who I went to a church and saw him playing, and that child play like a pro, fingers up in the air, and that sort of orchestra
Mm.
sort of playing. And I'm like, whoa, who taught him? The mother said he was never taught.
Right.
You understand? Right. So some of them have these unusual, skills otherwise.
No, I remember the flapping of the hands. There's a particular same guy, I think, that plays the piano at one of our churches. Whenever he gets very excited, he will jump up and he'll flap his hands. He'll flap his
Yes,
hands.
yes,
And
yes, yeah,
yeah. And one autistic person, she's a female, she said that looking in somebody's eye is like them kissing her. She said it was very intimate. And therefore she does not look in anybody's eye because of that. She says, by looking at somebody's eyes, it means that you're kissing them on the jaw or something. So you felt really uncomfortable with staring. So those are some of the things that some autistic persons that I come across have stated. Now, is it true that autistic children don't feel emotions or they lack empathy? I know that there's a show on TV called The Good Doctor, and he's autistic, and so therefore the portrayer has not been able to empathize with his patients very well. Or is it true that they don't want friends, or they don't really like friends, or that they don't handle change very well? Is it true that these is the characteristic of an autistic child?
yeah. All right. So let's start with the friends first.
Uh-huh.
The fact of the matter is that autistic children want to make friends, right?
Okay.
So they want to have people around. They want to make friends, and that sort of thing. But it's very uncomfortable for them, right? So
Mhm.
they will try and they're shunned because of their strange behaviors and their strange interactions and them not understanding certain cues, and certain innuendos. You make a joke, they just don't get it, and that sort of thing. They stand out in the group, they're the outlier. And that makes them a little uncomfortable. So it's not that they don't want friendship, but them making an effort and moving towards making friends becomes a little problematic for them, and hence they stay by themselves because that makes the whole situation a little more comfortable. And that's the importance of getting therapy. So it's easy for us to understand certain social cues and that sort of thing. An
Right.
autistic child, it's a very tough thing. You understand? If you
Mhm.
approach somebody and they kind of look at you sideways and make a certain gesture, you understand that this person don't want me around. I probably should stay away. They don't understand that at all, so they get themselves into a lot of trouble. A lot of situations. I had, when I was in medical school, I had an autistic doctor, student, and that child, that young man was topping, first to third year. That is when we were doing the book work. When he went to medical school, in the clinics, he lifted up a pregnant mother off the bed. You understand? She wanted to move from one place to the other. She explained to him she wanted to use the bathroom, and he just took it that she needed help with her big belly, and he lifted her off the bed and brought her to the bathroom. So he struggled with in clinical part of the course, but the knowledge part he did extremely well on. So there's social skill, there's social interaction. What was the first part of the
About
question?
emotions and empathy. Do they
Yeah,
have? Yes.
yeah. And it's not that they're, they don't have any empathy, and they don't understand, right? And it's something that they have to learn. And even in themselves. So they might be happy for you for something, and they cry. You understand? And they may be sad about something, and they laugh. Right? It doesn't mean that they are unempathetic or cruel, or that sort of thing, but they relate to these things in the atypical way. Not like myself and you will probably relate, and some people misunderstand that as being, them being unempathetic. So it's not true that they are like that.
Some persons say that they tend to be very rigid in their schedule. They like things a particular way, and if you change it, they get hysterical. They get upset.
Yeah,
Is
yeah.
it true that they don't handle change very well?
Yeah, definitely. And that's, one of the signs, the repetitive behavior. And they do these repetitive things, because they like things to be. And some of us without autism, we're like that, you know, like things to be
Right.
done a certain way, and they order things. So you might find that they're playing with their toys, and they put them in, a certain order all the time. They're lining up the toys instead of playing with them. They might be playing with the toys and playing with a certain part of the toys. The food is a problem. Feeding some of these children is a problem. I remember we had a child who had diabetes and autism, and
Mm,
that child was the most difficult child to manage his
right.
diabetes, because he has to go through a ritual when he eats his breakfast. And the breakfast starts from probably about 7 o'clock, and it finishes at 9. You understand?
Wow.
Because he has to take up a cracker, he licks it, he put it back down, he put the cheese on, he licks it again, and he does this routine and this ritual, and it made his diabetic control extremely difficult. So they have this rigidity, in their minds too, just the way they think and order things, and in the way they interact with certain environmental triggers. You might have a child who you're taking to school every day, and you drive a certain route, and the route becomes blocked, and you're driving the opposite direction to get to the certain place, and all hell break loose. So you
Yeah.
have to be aware of, okay, you might be wondering what happened to little Johnny, right? It's just that he's used to this routine, and you change his routine. His
Mhm.
plate. He's used to this particular plate to feed from, and then suddenly you decide that you're going to buy a new plate without consulting with little Johnny, and he stops eating. That's it, right? So just understanding the little nuances will help you, deal with them and managing them and supporting them well.
Amen. All right. So you mentioned earlier that they have this knack or ability to do things excellently, beyond the normal. Though they may have other issues with interaction and social and stuff like that, but they tend to have certain intelligence or certain gifts. So they can play the piano without any, you know, nobody taught them how to play. They may be outstanding IQs. They may be able to have knowledge that others may not even would have heard of. Why is it that these autistic individuals have this extra gift or incredible gift that they possess? Why is that so?
I'm just to say quickly that that is the um, what you call it, a small percentage of children, right? So we get, the movies kind of portray autism or children with autism with these skills and that sort of thing, and they're brilliant and they, and stuff, but that's not necessarily what happens with most children, right? So a lot of them have intellectual disabilities and need help and support. They need support in school and that sort of thing. So you have a small percentage of children who, they used to call them the savants, who have these special abilities, to learn. And the other thing is that they might be very good at mathematics, but they just can't deal with, the fine motor skills or language, and that sort of thing. So you're not going to find autistic child usually just right across the board mastering, everything. It might be good in a particular area, but definitely they usually need support, in other areas. The reason for this, I mean, I was reading research that that did. What I should have mentioned also, Douglas, is the whole issue of screen time, right? So they're doing a lot of research on that. As I said, everything is not clearly delineated, but I read an article last night where a recent research was done, which shows that, when children are exposed to these audio visual screen time sort of stuff at a very critical period in their development in a genetically predisposed child, that can actually put them at risk for developing autism. So, all the international associations do recommend that children under 2 are not supposed to have any screen times. They were even making the point that when television came around and when the cable came around, they saw a direct correlation with autism, almost, an increasing autism with the increased exposure, the increased availability of, the screen time to children. Right? So that is also an important.
Interested, because you were saying that you're seeing a little more prevalence even in your own practice at Gleed, that persons are more coming in, and maybe because we all have smartphones now, why the incidence of autism is even greater. Screen time is a major problem. So you're saying that screen time should be none at all or very limited before age 2?
Yeah, so under 2, no screen time is recommended. So the parents usually get excited about, oh, he's watching TV, Dr. Price, he's so intelligent, he's looking at the TV and he's sitting there, the little 6-month-old baby, right? So no screen time under 2, and over 2, 2 to 3 hours max for the day, right? That's what we have seen, even though, they're still doing the research on autism and screen time. We have seen some very strange behavior, some very abnormal interactions in children who get exposed to screen time for a very prolonged period of time.
But Dr. Price,
concerning.
You know that the mothers and the parents are going to tell you that, but doc, I don't have the time, and if I just give them the phone, they remain quiet for hours. What am I going to do now?
That's it.
What do you tell a concerned parent?
That's it. And what I say to the parents, create a space, right? Because the problem with screen time is that you're sitting in front of a screen, you are looking at that screen for hours, and in that critical period where this baby's brain needs to be developed from him making association, looking and touching. I was watching a baby on the ward today, and he saw a little, circular thing. The children don't need much. Make a safe space for them, either build some barriers or whatever, so you can monitor them within a particular space so they won't hurt themselves, and place, these blocks and these what in the environment, nothing sophisticated. I remember when my daughter was 4, I bought this very expensive, what they call it, leapfrog thing, and she took up can and was knocking on the can and ignored the leapfrog. Children learn on their own. They do these associations. Just provide a safe space and a safe environment. Have time when you do outdoors, where you just let them. You have lock up a child in a house and you let them out in the public, look like, they're just free, exploring the environment. Take them out in nature, teach them about God in nature, make them make those associations, sitting down and looking at the screen. Even the parents might say, oh, it's ABC, the learning. Even that is a problem, right? Even if it's an educational program, sitting down in front of a screen damages children's brain. That's the message.
You heard the consultant pediatrician with experience, backed up by research. Parents, do not give your under 2-year-old child a screen, tablet or phone or television. Allow them to play and develop, allow them to explore and build their senses and know what things are. Parents, it's in your best interest for the good of your child. Because many of us, when we grew up, we did not have a screen, didn't have a TV. We had to play. We had to go outside and climb and touch things and play with dirt. We need to go back to allowing exploration of our environment. All right. That being said, can somebody with autism live a normal life?
Certainly, right? I have the fact of the matter, Douglas, is that you probably have somebody sitting beside you. The incidence of autism, or should I say, the prevalence of autism in Jamaica is now 1 in 36, right? And internationally, it's 1 in 36 to 1 in 100. That is a very, very high prevalence of autism. It's a lot. Yes, they can live a normal life. As I said, individuals are along a spectrum. You have those at the extreme end, those at the higher end, the higher functioning children. Children in high school, prominent high schools all over Jamaica, and doing extremely well with support and help. Even the lower functioning ones, they can live a decent life. They can learn certain skills, giving them the support that they need, giving them the behavior therapy. Diagnosing them early is going to be helpful to their long-term outcome.
And how do you diagnose them early? What's the process for a parent to diagnose their child?
It's recommended that all children who are between 18 months and say 2-3 years, they need to be screened for autism. It's a very common condition, and then every child needs to be screened. So a pediatrician or your general doctor might screen a child by just observing the child in the office. But there are objective tools, right, that can be used. These tools include your MChat. MChat means your modified checklist for autism. MChat. So you can go on Google and just type in MChat. It will come up with a questionnaire. They are assigned a score, and based on the score, you can determine that this child is probably has autism and need to further evaluation. So your pediatrician will use, those things. You have the ACTS, the ages and stages questionnaire, the ASQ, you have the STAT, the screening tool for autism for toddlers and young children. So you have various tools that you can use to screen the child. Parents can use them. You can just go on the Google, look for your MChat, fill it out, and take it to your pediatrician or your doctor, and they will take it to the next level. The next level will be a formal assessment by a developmental pediatrician or by a psychologist, right? And once they're diagnosed, you take it to the next level.
Excellent information. At this time, we're going to take a short break. I want to come back for the last part of the program where we take your questions. There are a number of questions in the chat, so we're going to ask Dr. Price to answer your questions right after the break.
The Seventh-day Adventist Church Central Jamaica Conference, in collaboration with the Christiana and Spalding's District of Churches, present the Good News Gospel Campaign and Community Empowerment Program. Join us from April 20 to May 18 under the big tent at Cobbler Playfield. Come experience power-packed preaching, soul-stirring music, prayer and fasting, marriages, baptisms, baby dedications, free Heart NSDA Trust certification, free health care, RGD services, prizes and surprises. That's the Good News Gospel Campaign and Community Empowerment Program. April 20 to May 18 at the Cobbler Playfield. See you there.
Welcome back, welcome back, welcome back. Dr. Price, a question is posed to you. I think based on when you mentioned not being able to communicate or talk, there's a question that was being asked. This comes from Sylvia. My grandson is 18 months now, or is 18 now, can't talk. He communicates through his iPod. Is that a common thing where you get to 18 years or 18 months? I'm not sure, Sylvia, if you meant 18 months or 18 years, but he communicates through his iPod. Is that a common thing for persons with autism? Dr. Price? All right, as we get by Dr.
Yes,
Price.
sir.
Yeah, go ahead.
Sorry about that. So he's 18 months and he's not speaking. Is that what you said?
I'm not sure if it's 18 months or 18 years, but he can talk and he communicates through his iPod. So I guess he may be 18 years.
So it's probably 18 years.
Mm-hmm.
There are some children with autism. We refer most of them for speech therapy, right? Or should I say to a speech pathologist for both an assessment and evaluation as to where they are, and hence the tool to manage their speech. But what I've found is that there are some children, irrespective of the interventions, or some of them would have gotten late intervention, they might not speak at all, right? And in those situations, then you have to use these tools that are available. Sign language also is something that is recommended for some of these children. It's something that we don't think about for children with autism, those ones who don't talk at all. But it's something, and the iPod is quite reasonable, right? It's quite reasonable.
All right. Aquila is asking, what measures are in place to assist parents with autism?
To assist parents?
Yes. Parents who have an autistic child.
I'm happy that we mentioned this, because we have a lot of issues in Jamaica with respect to managing children with autism. We have problems with having them diagnosed because we don't have enough persons, and most of the persons are in Kingston, and even in Kingston they are not enough. So people are waiting up to 6-9 months to get a diagnosis. After you're diagnosed, then the applied behavior therapy and that sort of the speech therapy that you need, you have to wait another 9 months. You have to wait another 6 months, right? So we do have major issues with Jamaica supporting children with autism. And if you will allow me, Douglas, and hence the Pediatric Association of Jamaica, we have been really trying to do a lot of stuff to support children with autism. We have a 5K run coming up in June 23rd. Children who have autism have a significant, I think it's 30 to 60% chance of dropping out of university, right? And we're looking at making some funds to help children with scholarships, going to schools. They have these specialized schools for children with autism that support them, give them the therapy and stuff, up to $60,000 to $90,000 per term. You understand? So we do have issues. There are support groups online that I encourage parents to join. We have a brother from one of our churches who, and I could give you the information afterwards. He has an online program, Brother Alain and Sister Alain. They provide a lot of good information, on how to manage these things, and how to get additional support. But as I said, we have this program coming up in June, inviting you to support it. so that we can help. Hopefully, it can be an annual program so we can help these children and support them, to live a complete and a full life.
All right, so I have texted our technical producer, Mr. Bonner, if she could just get that flyer up so that we can see that special 5K run. So if she can, she'll put it up for us, Dr. Price. And it's important that we do give support. They do need a support, and we need to actually have a way of our system. At the HS Walters, we do have a registered consultant psychiatrist that can also be of assistance. And so you can contact the HS Walters there, and they will actually put you onto our psychiatrist and help with the diagnosis. But my technical producer, Mishka, if it's possible, can just put up that flyer for you. Okay, there it is. All right. So that's the flyer. If you can give some support to this program, we greatly appreciate it. It's very important. June 23 is the date, and we do need your support. It's autism support, and of course, we deal with autism right now, and it's Autism Awareness Month. So please, 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 if you can, do the 5K run, help out June 23. All right, Dr. Price. The There's the question about vaccine. It's back up in the chat again because somebody is asking, um, can vaccines be delayed to a safer age? Person probably still fear. This is from Mario. He's probably still fearing the idea of vaccine link. What do you say to delaying vaccine to a later age?
Right. The person is really suggesting, he's still not sure, whether or not there is an association, and that's why the person is saying delaying the vaccine. The problem with vaccine is that it protects children at the youngest age, right? So children who are less than a year, less than 2 years, they're at highest risk of vaccine associated diseases. We have children still dying from strep pneumonia in Jamaica on our wards, because they didn't get the pneumococcal vaccine, which is, not commonly available in the public. Children die from a lot of these diseases, and they get better protection the earlier they get the vaccine. That said, I've had parents who have delayed, their vaccination because of concerns for autism. I have a lady in particular who she under no circumstances should giving her child the vaccine because she doesn't want her child to get autism. And guess what? Her child was diagnosed with autism. If you understand.
But no vaccine.
Yes, I usually give the parents the option. Vaccine is really mandatory in Jamaica. But some parents might say, all right, I got to delay it until he's 2 when he passed, the critical stage. But even with that, we have our children developing autism anyway, right? As I say, it's a complex situation. There are multiple causations and multiple interaction of the different, causation. There are critical periods and all of that, right? But we have not found any evidence at all, not even one for vaccine causing autism.
All right, so Romoria, I hope you understand right now that whether you're vaccinated or unvaccinated, autism is still there. So therefore, don't delay. It is for the benefit of the child to get the vaccination early. To Rosemary, you're asking about the prevalence now that you're seeing more children with autism. Dr. Price earlier stated that the early exposure to screen time beneath age 2 has been looked at as a risk factor. So children should not be exposed to screen time below age 2. Dr. Price, the last question before we close off, because you mentioned that sometimes one of the signs that the child may be autistic is they're a bit to speak. Their language skills may not be developed. So Wright is asking, my grandson is 16 months, still no word, but understands and obey all the commands. Should I be worried? Does this point to autism?
Right.
So he doesn't speak anything, but he understands.
He understands. The thing is that a child who doesn't speak, we have a list of differentials, a list of things that can cause a child not to speak. One of them is autism. A child might not speak because he has not been stimulated enough. And I don't mean that you're not caring for your child, but a child might be in the house with 2 adults or 3 adults, and he's the only little 14-month-old in the house. As I said to my parents, the children don't learn to speak from me and you. They learn to speak from the little chatterbox friends, in the daycare, and that sort of thing. So a lot of times I usually say to the parents, take the child out to, a daycare setting, or if you have a relative with some cousins the same age, just give them some time to interact. And with that alone, the children start speaking, and you don't spend a lot of money on evaluation and that sort of thing. Hearing issues can cause a child not to speak as well. So if a child is not speaking, all of them, autism or no, will need to get their hearing checked. But as I said, stimulation, most of the time, that's the issue. Some children have what we call developmental speech delay. So nothing is wrong with them. They have no, autistic behaviors and that sort of thing, but they just don't speak. And when they start speaking, they take off like a plane. And when you check the family, daddy might say, I never talk until I'm 3 or 4, and he's fine. So that's called developmental speech delay. Usually a hereditary sort of situation. Nothing is wrong with the child, but the child will speak. He's just have a delayed tendency to speak, and when he starts speaking, he's fine.
All right. I couldn't leave without asking this last one. For a person with autism, should parents try and control their behavior? So let's take the flapping of the hands because they're excited. Should a parent seek to stop the child from doing that activity, or stop them from tippy-toeing? Should parents seek to control that behavior?
Yeah, the fact of the matter is that's why we refer them to have what we call ABR, applied behavior therapy, right? So they really need to, because you might, out of your good intentions, but lack of what needs to be done, you end up doing the wrong thing and end up causing more, problems than helping the child, right? So the children really needs to have, and what I usually suggest, because they're very expensive, go to a couple of the sessions, once you learn the kind of routine, you do it on your own, at home, and get support from other individuals with similar problems, right? So just taking the child and tell him stop it and that sort of thing, definitely not going to work, right? You have trained individuals who are specialized in their behaviors and modifying their behaviors. Their specialized tool and specialized technique, and then accessing those will definitely help the child in the long run. Okay? You don't want to do more harm than good.
Thank you, Dr. Price. Thank you very much. And the online audience is saying that they have learned so much. They are great for the information. Thank you once again for being here and for sharing your wealth of knowledge with us. And we pray that the message of taking care of our autistic children will go far and wide, and that indeed that we will continue to benefit from good health. Thank you, Dr. Price.
Thank you so much for having me.
My pleasure. Thanks for watching, everyone. Remember to share the video. It will still be up right after we are closed here. Next week, Thursday, at our new time, because of Crusade coming up at 7:15. So next Thursday at 6 o'clock, we will be focusing on diabetes mellitus. So join us for that discussion on sugar. All right. So as we close, beloved, I wish above all things that thou mayest prosper and be in health, even as your soul prospers. God bless you. This has been Your Health and You. I am Dr. Kamara Douglas. Do have a wonderful evening. And of course, stay online as we go to our crusade coming up next.
The Seventh-day Adventist Church Central Jamaica Conference, in collaboration with the Christiana and Spalding's District of Churches, present the Good News Gospel Campaign and Community Empowerment Program. Join us from April 20 to May 18 under the Big Tent at Cobbler Playfield. Come experience power-packed preaching, soul-stirring music, prayer and fasting, marriages, baptisms, baby dedications, free Heart NSTA Trust certification, free health care, RGD services, prizes and surprises. That's the Good News Gospel Campaign and Community Empowerment Program. April 20 to May 18 at the Cobbler Playfield. See you there.